Hello, I'm Dr. Audrey Arona, CEO and District Health Director for Gwinnett, Newton, and Rockdale County Health Departments. During this challenging time, as we all work to protect ourselves and our families from COVID-19, one of the tools we have in our arsenal is testing. Knowing whether you're sick with this contagious virus can help you limit the spread of illness by helping you know if you need to isolate and wait to recover. While testing is important, it's more important to know when you should get tested. It can be unnerving to receive a call from a friend or a relative or a public health contact tracer to learn that you have been exposed to a positive case of COVID-19. Understandably, many people choose to quickly opt to get tested, sometimes as soon as a day or two after being exposed. But we have to remember how the virus works. This particular coronavirus has an incubation period of 2 to 14 days, which is why we recommend quarantining for 14 days if you've been exposed to a positive case. An exposure to a positive case is defined as close contact spending 15 minutes or more within 6 feet of a case. If you don't fall into that criteria, you will not be considered a contact. The current recommendations encourage you to wait to be tested on day 10 of your quarantine period unless you develop symptoms. However, if you develop symptoms during your quarantine at any point, you should get tested. Otherwise, wait 10 days after your exposure to the positive case. 10 days is far enough along in your quarantine period where you're likely to have developed the disease known as COVID-19 or not. To put this in perspective, testing is a point in time. Testing too early could give you false reassurance that you don't have the virus, when you actually may. By waiting to get a test after an exposure, you can get a more accurate assessment of whether you are infected or not. Regardless of your test results, but especially if you're positive, the guidance that we have shared to limit the spread of illness is more important than ever. You've heard that wearing a mask is important. We certainly recommend masks and face coverings to protect other individuals around you. However, a mask alone is not enough. Social distancing, that is, staying 6 feet or more away from others, can limit your exposure. Staying away from other sick people and staying home if you're sick is key to limiting the virus's spread in our communities. Lastly, wash your hands with soap and water often, use hand sanitizer if soap and water is not available, and clean and disinfect commonly touched surfaces often. Again, stay home when you're sick. Limiting this virus is a team effort. Following the guidance can protect you and your family. If you need a test, the health department is here to help you. Visit our website at www.gnrhealth.com to learn more about COVID-19 or to make an appointment. Thank you.